Hello and a very good evening to everyone. Welcome to today's session on sorry failure to grow in units by handling menopause by Apollo Cradle and Children's Hospital. We would like to welcome Dr. Jyoti Bhaskar, who is our in-house obstetrics and gynecology consultant. She holds a degree in MBBS, MRCOG, and FICOG. We welcome you, Doctor. You can now take over the session.
Thank you so much, Atul. So today, actually, I stand in front of each one of you as the secretary of the Delhi chapter of Indian Menopausal Society, apart from being, yes, a consultant at the Apollo Cradle. October is considered the month of menopause, and 18th October is the World Menopausal Day. And the theme this year is osteoporosis. And hence, I decided to talk to each one of you, all the young girls, all the women who are in the menopause or in the perimenopausal period, and all to the men who may also be listening, because they too have sisters and mothers, that how we can help our women who are in the perimenopausal or the menopause to lead a life of good quality. Why is menopause so important? The average age at which an Indian woman achieves menopause is 46 years. This is about 6 years before their Western counterparts. And the expectancy of an Indian woman, with the latest statistics, is somewhere about 70 to 75 years. So if you estimate nearly about 25 to 30 years of a life, a woman leads in menopause. That means nearly 1/3 of her life she leads in menopause. So can we really write it off? No. That's the time that we need to ensure that a woman leads a life of quality. In India, we expect nearly 130 million women are actually in menopause. So today, what I'm going to be talking about is a wonderful theme that has been given by the Indian Menopausal Society. Fit at 40, fabulous at 50, strong at 60, serene at 70, and independent at 80. So when we talk about handling menopause, we are talking about a woman achieving these landmarks at every decade of her life. So what exactly is menopause? Technically speaking, when a woman stops having periods for a period of 1 year, she's said to be menopausal. And why do the periods stop? It is because every woman is born with a set number of eggs which are released every month from the day she starts a period, that is called as a menarche. And when these eggs finish in the ovary, the periods stop coming and she lands up in menopause. But is menopause just about not having periods? No. Menopause has much greater implications because with the eggs finishing off, the ovaries, which tend to release a very important hormone called estrogen, the hormone which is important for the woman's womanhood, for her skin, for her glow, for the mucosa, for her bones, for her heart, for her hair, and for her being the woman that she is. That hormone starts waning once she enters the age of 40 plus. And when it starts waning slowly and slowly, it may take about 5 years, it may take about 6 years. And that's the time we call as a perimenopause. When apart from the deficiency of the hormone, her periods too tend to get irregular. They may get delayed, they may come early, they may be heavy, they may be light, and slowly she walks into the menopause. So the problem actually is the deficiency of this hormone estrogen. It's slowly waning off and stopping at the time of menopause. And this is what leads to all the problems that a woman has of menopause. And this is what is the basis behind the fear, the anxiety, and the scare a woman has that when she enters menopause, what is going to happen to her. So let us see exactly what happens to a woman during the menopause. At the start, I would like to say that not all women face these symptoms. It is important for us to be aware that these symptoms are because of menopause. Because if we are aware, we are able to accept it well. And if we accept it well, needed, we take an advice and then we are able to act on it. So let us look at what the menopausal symptoms are actually all about. The commonest among of all the symptoms, nearly 80% of menopausal women tend to suffer from something called the vasomotor symptoms. This is a time when a woman suddenly feels hot in the upper part of the body, goes red, and then she starts sweating. Sometimes it is so profuse that she gets up in the middle of the night. If it happens during the day, to be able to perform at work becomes really difficult. Initially, it may be less frequent, but as the menopause tends to become more nearer and severe, it may get so severe that she may have it about 8 to 10 times a day. And her quality of her life, she undergoes depression, she undergoes severe anxiety, and it becomes really difficult. This is the symptom which may last after menopause for 4 years, 6 years, and sometimes in some women, even up to 10 years. And this is the most bothersome symptom. Apart from this, nearly 45% of women tend to have problems with sleep. They always complain that we are unable to have a good sleep. We have insomnia. They tend to become more forgetful. They tend even to undergo a lot of anxiety, a lot of depression. About 45% of women complain of vaginal dryness. They complain of vaginal itching, which is quite persistent, a little discharge. Many of the women also complain of dyspareunia, not wanting to have any sex. These all symptoms are sometimes very severe, so severe to really affect the quality of life of a woman. While the VMS, that is the hot flushes and the night sweats, may wane with time, with period of 8 to 10 years, they may totally disappear. But the symptoms of cognitive problems, of sleep disorders, the symptoms of vaginal problems of discharge, which we call as a genitourinary symptoms, they tend to keep on increasing as the age advances beyond the case of menopause. So these are the short-term problems that we are talking, which tends to really affect the quality of life. But much deeper are certain more problems that we really need to talk about. And that is the risk of a woman developing osteoporosis. Now, what is osteoporosis? This is the bones becoming brittle, the bones losing their matrix, their calcium, and becoming very prone to fractures. The woman who's osteoporotic, a very small fall, a fall which would not have affected anyone else, will result in a fracture of a femur, will result in a fracture of a wrist. And this is because the bones have become osteoporotic. For this, we need to really understand that what is most important is the peak bone mass. A woman develops the peak bone mass by the time of the age of 30 years, and it remains more or less constant by the age of 50 years. And after 50, when she develops menopause, because of the lack of the hormone estrogen, which is continuously decreasing, the support to the bone becomes much less. She starts to lose the bone. The bones become much more brittle and prone to fractures. So, this is one of the problems of menopause, of estrogen deficiency, which we really need to work to prevent. The second problem that can occur is making a woman more prone to cardiovascular risks. It is well known, and I think all of us have this myth that since we are women, we are more protected than men against cardiac disorders. But once you reach the menopause, the cardioprotective effect of estrogen comes down. And over a period of time, 10 years, 15 years later, you are as prone to cardiac problems as any male is. So if we look at all these particular problems, we need to consider how do I handle menopause? So I said there are 4 A's that are very important. First, we need to be aware that each one of us is going to undergo menopause. It is a very physiological condition. Not all women suffer from any of these problems, but yes, we can have these problems which we can accept. So the next stage comes that if I'm aware, then I'll be able to accept. And when these problems come, I'm the right mental frame. I know exactly what I need to do. And I'm able to really move ahead, taking the menopause and its symptoms in my stride. Advice is yet another essential part. I need not suffer slowly at home, alone. If I know I have these problems and they are because of menopause, I need to go and talk to my family. I need a family support, and with them, I need to go and meet a gynecologist. You do not need a family to come to a gynecologist. You are a strong woman. Anytime you feel you have severe hot flashes, if you feel that you have a lot of vaginal dryness, that sex is totally difficult for you to do, it's very painful. You really have a very low libido. You're feeling mentally depressed, you're feeling very lonely, anxious, forgetful, not able to sleep. Please come to your gynecologist. And lastly, on the advice given by the gynecologist, you need to act. So, what exactly is the advice that you're going to get, which you can also implement yourself? The first is the lifestyle modifications, which means that you need to have a good diet. Important over here is, of course, a good amount of proteins, but calcium as well as vitamin D. A postmenopausal or a menopausal woman needs approximately 800 to 1000 milligrams of calcium daily. Please ensure that your diet is able to provide you that. That means you're having enough of milk, you're taking paneer, you're having ragi, you're having legumes so that you have enough calcium. But if you feel it is not enough, there's nothing wrong in taking a supplementation of about 500 milligrams of calcium daily. Important to get your vitamin D checked out. We need about 600 international units of vitamin D daily. Although it is said that you need to sit down in under the sun to be able to get vitamin D, but it is extremely difficult. So if your vitamin D assessment shows that you're deficient, please correct it with the right advice. Otherwise, if it is right, then please maintain it with taking approximately 600 units of vitamin D daily. The next important thing is your exercise. A daily schedule of exercise, 1 hour morning, 1 hour in the evening if possible. The exercises have to be the ones which tend to increase your balance, which tends to increase the strength of your muscles. Muscle strength is something that's very important of the thighs, which we call medically a term called sarcopenia. If this strength is not very great and you're not able to do exercises to increase the strength, the likelihood of falling and having fractures tends to really increase. So, with a diet and a good exercise, starting not just when you reach menopause, but much earlier, I would say at the age of 35, 40, start preparing yourself for menopause by adopting a good diet and exercise. The third thing, which is very important, is your mental makeup. For a mental makeup, that would say, if we say that yoga is for the body, you need to undergo a training for your brain, which would mean that you need to get your brain to be involved and busy. Have a very good social circle. Have a lot of friends that you can talk to. Have good relationships within the family with whom you can communicate extremely easily. If you're working, continue to work as long as your body and your mind allows. It is important to employ yourself into areas where you can give to others. More importantly, is to have faith, to have some meditation, to get into these so that you are able to have a lot of positivity within your life and your mind too is going to be active. If, despite all these things that you are undertaking, you still do have symptoms of menopause, please approach a gynecologist. What are we really going to do for you? Of course, a detailed examination. We advise you to undergo screening. Screening is definitely for the breast cancer screening, which every woman after the 50 should be undergoing. A cervical cancer screening, which again has to be done once every 3 to 5 years from the time you are sexually active. Your blood pressure, your lipid profile, your sugar levels, the basic investigations are going to be carried out along with an ultrasound. After that, we are going to start you on hormones. Here, I would like to tell each one of you, we all are extremely reluctant to take hormones. We have so many myths associated with taking the hormones. The risks that if I take hormones, it will lead to breast cancer, it will lead to MIs, that's myocardial infarctions. But here I would like to say that when we start the hormones at the right time, and the right time is that before the age of 60 years and within 10 years of you attaining menopause, the hormones do far more benefit than they are doing any risk. And the hormones we tend to give you are only when they are indicated and for the duration which is shortest possible till your symptoms become all right. On average, the maximum that you would need is only for a period of 5 years. So if we start before the age of 60, within 10 years of your menopause, the hormones are extremely beneficial. And the hormones we are going to give you is the one that's deficient in your body, and that is estrogen. A very minimal dose of estrogen is given to you in a form that is easily absorbable and has no side effects within your body. Now, if you are in the perimenopausal period, that is when you're having irregular or maybe you're having periods, but you're suffering from these hot flushes, then the hormones that we tend to give you are estrogens plus another hormone called progesterones to protect your uterus, and they're given cyclically so that you keep having your periods. Once you attain menopause, that you do not have periods for last 12 months, then we put you onto continuous hormones where continuously estrogens and continuously progesterones are given to you on a daily basis. We call to see you back after 1 month, then 3 months, and thereafter annually. And I can really vouch that women who are on these particular hormones, the symptoms tend to disappear within 10 to 15 days. And these women, even when we ask them to stop it after 3 years, 4 years, or 5 years, tend to refuse to stop it because that feeling of well being, the good skin, the glow on the face, the hair, the feeling of strength within them, the empowerment because of this particular hormone is miraculous. So, here it is very important that if you do have a problem, you meet your gynecologist. Hormones will only be started if they are indicated in you and given for the shortest possible time. And you're going to be continuously re-evaluated, and these hormones will be stopped once your symptoms are far better. Now, coming to the problems that you ladies tend to face as far as the vaginal dryness is concerned. There has been a study in UK where it has been found that because of the vaginal dryness, because of the pain and the itching within inside, sex really goes off the menu for nearly 50% of women. They do not have that sexual desire in them. So, for this particular thing, I would really advise and ask each one of you, if you are facing these problems, come to us early. Do not come to us when it is quite late, because then, if we do help you out with the hormones and the treatment, it doesn't bring about a greater effect. So, if you start facing these problems, do approach your gynecologist, even if you do not have the vasomotor symptoms. For the vaginal problems, we do not give you anything to be taken by mouth. The treatment is totally vaginally. There are a lot of moisturizers which are available. There are a lot of hormonal creams which are available, which you need to just insert into the vagina. And they tend to improve the health of the vagina, the mucosa, the secretions, and brings back the vagina back to the norm. They can be given for 3 months, and if needed, even for an extended period of time. With these vaginal hormones or treatment that we tend to give you, you do not need any much monitoring because they're not absorbed into your body. And it is always said that having sex is one of the best ways to keep the vagina moist and to keep it healthy. Coming to the next important point, and that is about osteoporosis. As far as the osteoporosis is concerned, we have, as gynecologists, we have really changed the way we look at our women. The moment a woman of 40 years or plus comes into our clinic, we start thinking, is she at a risk to develop osteoporosis? There's a particular score called the FRAX score, which is based upon the history. We conduct that score on every woman and find out what is her risk of developing fractures in the next 5 years or 10 years. And based on these scores, we ask them to get another test, which is called the BMT. That's a DEXA scan, which you come to know of the spine as well as of the femur. And there we score whether a woman is an osteoporotic or she is osteopenic or she's not. And based on the type that we get on this scoring, a woman is then advised the medications. The hormonal therapy for osteoporosis is not given to all. The treatment generally is biphosphonates. And if a woman is unable to take that, it is only then that we give them hormonal therapy. Thus, it is important to prevent osteoporosis and than to treat osteoporosis. And the prevention starts much earlier in the youth, when the girls are advised to take good food with a lot of milk, a lot of calcium, have regular exercises, so that the basic bone mass is big. And if the mass is good, then even at menopause, they're not going to land up with any amount of osteoporosis. Even these hormones, they tend to help against the cardiovascular risks. When taken at the right time, that is again below 60 years of age, they tend to protect a woman from any heart attacks, any strokes, and they're found in these cases to be protective. And just lastly, I would like to talk only about the women who've had the uterus removals. Uterus removals sometimes can take place much earlier in life, maybe around 40, 42 years because of fibroids, excessive bleeding. We do not remove the ovaries till the age of 65. The ovaries are fine because these ovaries continue to produce these particular hormones which are essential for the woman's health. In case for any reason the ovaries have been removed, then you will need to be given estrogens till the natural age of menopause, which is 46 to 48 years. And if you do not have the uterus, then the only hormone we give you is estrogen. About 5% of women have the periods finishing before the age of 40, and they are called the premature ovarian insufficiency. They're highly unfortunate to have the periods finish before the age of 40. But yes, we have enough medications to keep them healthy till the age of menopause. This may occur because they may go into menopause because of the family or the genetic conditions, because they've had some surgery, because which ovary had been to be removed, or they have been exposed to some chemotherapy. These women are then given hormonal pills to the age of menopause, and then they're stopped so that the bones, their heart, the skin, the vagina, their mind, everything remains active and normal. So I would like to just end by saying that the word is menopause, but it actually stands, if you break it up, me, no, pause. That a woman, even if she enters into menopause, she's not going to stop her life. She's not going to let her life go down. She's not going to deteriorate the quality of her life. She needs to accept it. She needs to take the right advice at the right time. Take the medications. Do not have any scare of these medications. They do not cause breast cancer in women who have been properly evaluated and if they have been started at the right time. They are safe. We have plenty of medications which can suit you. Every medication is individualized and given only after we assess you. And these hormones will really help you maintain your health and a long term health so that you can lead a life which is independent even when you are 80 years of age. So, to all the girls and all the women, please help the women who are attaining menopause and be big support to them as a family and help them at every step. So thank you very much.
Thank you,
I'll
Dr. Wade. We have
questions.
a few questions for you, yes, Doctor. So the first question is, can menopause be delayed?
Uh, Menopause is a very natural process. It is about the number of eggs that you have. So you cannot naturally delay a menopause because once the eggs finish in your ovaries, they just finish and you land up in a menopause. What you can take control is the symptoms of menopause. That means the symptoms that I have been talking about of the hot flashes, everything, they can be controlled and prevented. But as far as periods stopping is concerned, no, that is cannot be delayed. It will happen when it has to happen.
Right. So there's also this myth that women tend to age after menopause quickly. Is it really true, doctor?
Okay. So it is all about what you think is aging about. So everyone ages at that particular time. It's all your concept. Previously at 50, women would be grandmothers. They would be having baby grandchildren to take care, and we would say yes, they've entered the third phase of their life. That is the last phase. But now it is not that. So menopause is not about aging. Menopause is a normal process that tends to take place. If we take good care of ourselves, as I have said, with an exercise, with a diet, and if we approach and get the help at the right time, menopause will not lead into aging. And taken care of menopause, where you have symptoms, where the estrogen is really going down, and you're just sitting on your bed and just lamenting and not doing anything about it, then yes, your bones are going to go, your heart is going to go, your skin is going to be on the less side, and more or less your mind is what you have to really take care of at that time. Yes, Jyoti.
The next question is, doctor, how can one overcome the effects of menopause?
Okay. So, as far as the effects, as I said, the predominantly effect is hot flushes and night sweats. The other effect is the vaginal dryness and dyspareunia and decreased libido. And the third effect is the mental anxiety and the depressions. So, the first of all, it is a lifestyle that you have to take. Mentally, be accept the fact that yes, I'm going to go through menopause and I may have these symptoms. The moment you are ready for it, you have actually won 50% of your battle. Second thing in that case is prepare yourself from the age of 40 years. Start getting to a lifestyle which is much better in the sense of good, healthy diet. Stop off your junk food, going out. Alcohol has to be limited. Smoking has to be, you have to quit smoking. You need to have diet which is more proteins, more calciums, as well as vitamin D, and go for a regular exercise. If you have done all these things from the age of 40, by the time you tend to reach menopause, you will not be able to experiencing half the symptoms. But if you do have any of these particular symptoms, please come to a gynecologist. You have hormone therapy. Don't be scared of these hormone therapies. We give them for the shortest possible time and only if you need them. And that will make you sail through the next 4 5 years and you will be just moving on to the serene 70s.
Right. The next question is, Doctor, how early can a woman go through menopause, or does it have an age bracket where you'll have to prepare, or sometimes it can even affect in case of few women it can affect them at an early age, and what would be the cost as such for that?
So, as I said, the average age in India is 46. So, when we take an average
Right.
age, that means some women are having it less than 40 and some are going even till 55 years of age. So, we have about 5% of women who tend to have menopause before the age of 40. So this is what we don't call menopause, but we use the term premature ovarian insufficiency. So at that time, they stop the periods, their eggs tend to finish. If we do certain blood tests, we find that the levels of FSH, which is the test that we tend to do, are really high. So these particular women may naturally go into these particular menopause because genetically their mothers also had an early menopause, the sisters also had an early menopause. So you tend to be prone to get it. That's a natural way to go into menopause. Others may have a menopause early because of certain problems with the ovaries. Like we have endometriosis, because of which you've had repeated surgeries done. So the ovary part has been bit by bit removed. So the amount of ovary left in your body is very less. As a result, you will land up with a premature menopause. Or for some reason, you have had a surgery and both the ovaries have been removed. Or you are a cancer patient and you have been given drugs which have brought your ovaries to become non functional. Such people will have the menopause much earlier than the natural age of menopause. So for them, the advice would be that if you're having it much early, you need to be put on certain hormonal therapy like contraceptive pills or the same hormones from the time you have menopause till the age of natural menopause. So
Right,
that is,
Doctor.
yeah.
All right. The next question is, Doctor, is it possible to go through menopause twice in a woman's life?
No, menopause comes only once.
Only
So
once. All right.
only once. You can't have it twice. Yes.
And you mentioned that you give hormonal therapy as and to slow down the effect of menopause. So does it have any side effects as such, Doctor?
See, per se, the hormones do not have any side effects, but yes, there are certain risks that are there. And the risk that we are mainly talking about over here is the risk of the breast cancer, which everyone feels that it may be higher if you're taking these particular hormones. So again, I would say when we start the hormones, we evaluate the woman properly. We find out a history of any breast cancer in the families, and there are certain Gale models which we have, and we tend to put the history, and they're present on the various apps, and we find out what is the risk of this woman having a breast cancer. So if you find that she falls in the low risk area, and we have given her before she's 60 years of age and within 10 years of menopause, it does not increase the risk of breast cancer. If you really look at all the evidence, not giving the hormones to the women who need these hormones, we tend to increase their death rate because they get very much prone to cardiovascular defects, they get prone to colonic cancers. Giving these hormones tends to protect them against a lot of other cancers and a lot of other eventualities that can take place. So risks are minimal, benefits are maximal if given in people who need it and who have been properly selected.
The last and final question before we conclude our session, doctor, is what can be the cause of occasional bleeding or spotting after attaining menopause, doctor?
So I think this is a very important question because after menopause, no one should have any bleeding. If 12 months you've not had any periods, do not sit at home. This needs to be evaluated. And what evaluation we really need to do is basically to rule out cancer. Now, I need to tell over here very clearly the chance of cancer in a woman who tends to bleed after menopause is only 10%. But all our investigations are directed to be able to find that 10% of women who may have cancer. The commonest
Right.
cause is again atrophic vaginitis, where your vagina and your cervix, because of low hormones, has got very rough, it's got very dry, and that is what tends to become a source. So, whenever you have postmenopausal bleeding, please contact your gynecologist. Do not sit at home. Do not be scared. Do not think that we are going to diagnose cancer in you because your chance of having cancer is just only 10%. We need to find other reasons, treat them, and it doesn't mean that your uterus will be advised to be removed. All we need to do is screen you, reassure you, send you back home, and if needed, only then the surgery will be done for you.
All right. Thanks a lot, doctor. You've been very informative on this session of handling menopause. We look forward to having you on very such more important topics in the future, doctor. Thanks a lot for your time, doctor.
Yeah, thank you so
Thank you
much.
all for joining us. Yes. Thank you.
Thank you. Bye.